Well, the next speaker for today evening is Dr. S.M. Anwar Sadat from Bangladesh. He is an associate professor of oral and maxillofacial surgery and a consultant at the Square Hospital Limited, Dhaka in Bangladesh. He has advanced training and expertise in oral cancer surgery as well as reconstruction. I welcome Dr. Anwar Sadat.
Thank you so much. Good evening. I would like to thank to Dr. Ahmed from Canada especially and the organizers, Dr. Puneet and Dr. Hasid especially for giving me the floor. I am Dr. S.M. Anwar Sadat from Bangladesh, and basically I am in the maxillofacial surgery and special work in the oral cancer, but also lead the general dental practice in a private tertiary level hospital. So the topic on which I will talk is the changes in the clinical management in new normal in dentistry, that is old normal to the new normal, and the South Asian perspective. The recent COVID-19 pandemic and similar communicable diseases have always posed a high risk to the health professionals. It is known to all. And especially the aerosol generating procedures from aerosols contain bacteria and the fungi and the viruses. And dentists who treat patients using aerosol generating procedures are at very high risk of being affected by the patient and also cause transmission to others. And not only the dentist, but also the dental assistants, we should bear in mind, and our staff, clinical staff, and the patients have the highest occupational risk for COVID-19. So the dental professionals in many countries all over the whole world, not only in the Southeast Asia, and have stopped their practice because of fear of spreading COVID-19. And this brings significant financial impact, no doubt. Not only the financial loss of the dental specialists or healthcare providers, it has impact on the patients who had midway through different procedures like the filling, like the root canal treatments, orthodontic treatment, implants, maxillofacial surgery. So huge suffering of the patients for the whole 6 months. So we are on our way to start our practice, and not only in Bangladesh, also in other parts of the Southeast Asia. I think almost all dental surgeons and their specialists are trying to start their practice. I am a maxillofacial surgeon. I haven't stopped my maxillofacial surgery since March 15, and I am continuing my practice, and hopefully, and for the sake of Almighty, I am with my staff are safe, and that needs a very good protocol that the different international agencies and other health authorities have supplied to us. So what do we need to start the practice for our dental practitioners? That is the implementation of several technologies like the equipment can protect the dental healthcare provider, no doubt. And also the patients from aerosol infection, particularly those who are dealing with the root canal treatment and its allied specialists. And to take your dental office COVID safe free, COVID safe zone for your patients, for your staff, for your doctors, and for your assistants. And how can we change this management? Change in the patient evaluation, change in the upgrading the environment, change in the protecting dentists and their staff, and also special equipment that Dr. Puneet was telling about some instruments like the electric handpieces. And first, I'm coming to the patient evaluation. We can evaluate the patients by trials method that other speakers already told. We can use the thermal guns on the infrared thermometer to detect the patient's temperature. But one thing we should bear in mind that we have lots of patients, almost 60 to 70% of the COVID positive cases are asymptomatic. So we should bear in mind that every patient's attendant who comes to our clinic should be regarded as COVID positive. And in that way, we can also evaluate the patients by the thermal scanners and the pulse oximeter. But I do believe these have very less importance in our daily dental practice. We can upgrade our environment for patients and the healthcare providers, especially by the IQ air system ERP repairs, HEPA filter. This has very good impact on very good setup of our new dental clinics and the offices, and also the foggers and the ultraviolet light. And this air purifier should be HEPA filter like the high efficiency particulate air, which can ensure you very good environment in your office. But we should not forget about the other methods to be followed, like the restricting using the fans in our practice. And we should keep our windows sometimes open during the operatory procedure. And also using the exhaust fans, which can keep your dental office more or less safe. And not only the environment, we the dental specialists and our assistants should be aware of protecting ourselves from COVID-19 by the personal protective equipment. And proper N95 is the key to protect ourselves from the any suspected or COVID-19 positive patients and also the respirators. And regarding the personal protective equipment, sometimes we have concentration on the face mask only, but the face shield has a tremendous role in preventing the affecting by the COVID. So along with the mask, and I'm going to talk about the type of the mask. And along with the mask, we should be very careful about using the face shield and goggles and the other things like the gloves, face protection, headgear, gown coverall, and shoe cover. Not only the protecting the face, I think your whole body can be protected by this personal protective equipment, as you don't know when the other surfaces of the body will be touched by you, or you can contaminate your face in any way. So it's better to protect your whole body by the personal protective equipment. And especially as a surgeon, I would like to say that it's very safe to operate a patient in the operating theater rather than in other time. As in this COVID period, we are very much aware of sterility, we are very much aware of our hygiene and everything. So I don't think the surgeon should be very much fear about doing the surgery in this COVID period. And regarding the face mask, we have the best one supplied thing is the N95 mask. And there is no alternative to the N95 CM1860 and also other respirators which are very beneficial to protect yourself. And the other one is very now becoming very familiar with the dental surgeons who are dealing with the aerosol generating procedures like the PAPR, powered air purifying respirator. It has definitely, it has more efficacy, it has more power to prevent you from affecting by the COVID-19. But healthcare providers, but not necessarily all the examinations, in all examinations of the patients in consultation, you need to wear the PAPR. Simple N95 mask, cover with a simple surgical mask, and you can wear 2 or 3 masks for extra protection. You can examine the patient. But especially this PAPR can be used in healthcare providers in some COVID affected areas, especially those patients are more susceptible to the COVID or the COVID positive patients. And but strict care should be taken during the reusable elements and replacing the filters if you use the PAPR. And the filtering face piece respirator classes like N95, not always you need to wear the N95. Say for in our country, in Bangladesh, first time we didn't get the N95 properly, but now it is almost available in our country. But the same equivalent quality mask can protect you from the COVID-19. That is KN95, FFP2, P2. Just these are the same quality from the N95 mask. And it is not recommended to use the P1 and FFP1 as these have only at least 80% protection from the COVID-19. So at least we can consider FFP2 and FFP3 and the N95. But the N99, FFP3, and N100, those are best, but it's not available at this moment. So special working instruments along with the environment we can create for the general dentist and to have a safe environment for the dental practice, we can consider the special working instruments like the electric handpiece. And also the high volume sucker you can use rather than a low volume sucker of the salivary injector. It has good role in decontaminating of your area. And also there is an importance of the rubber band who can use it, but this cannot ensure the 100% protection of it. So you should have the personal protective equipment, along with all these things can protect you from the COVID-19. And it prevents contaminated aerosols from the escaping of the mouth. And if we talk about the electric handpieces, definitely it has a very good role at this COVID pandemic time, as its greatest advantage is the less aerosol generation, and also it's smoother and more precise cutting due to the stable speed. And I think the endodontist can say more about the electric handpieces. And though there are some disadvantages of this electric handpiece. And at the last of my presentation, in 2 slides, I will be talking about my take-home message. Before that, I think many of the audiences are the maxillofacial surgeon colleagues, my colleagues. They can think of the tactics of the maxillofacial surgery in this COVID situation, and don't be afraid of doing the maxillofacial surgery at this moment, especially the who are very young and not vulnerable to the COVID at all. And please do every patient pre-operatively COVID test RT-PCR before doing the surgery. It's very easy, and it is advisable to admit the patient first, say for fracture patient or the maxillofacial surgery or the cancer surgery or the tumor. Firstly, you can omit the benign lesions at this period, but you should not ignore the cancer cases. So you can admit the patient, do the RT-PCR, and to test the COVID, and then let the patient enter into the theater. During the operation, during the intubation by the anesthetist, please don't stay within the operation theater. Your whole operation team should be outside the operation theater, and ask the hospital to ensure the negative pressure ventilation in the operation theater. And during the intubation, your presence will get harm to you, so don't stay within the theater. And during the surgery, you can avoid some operatory instruments like the handpieces, like the drilling, and whether you can use the chisel, bar, and these things for cutting the bone and something like that. And be careful about the irrigation during the procedure. So, at the end of my talk, I can share with you some take-home message like for protecting your staff and the patient, there is no alternate to the room ventilation and appropriate personal protective equipment, along with the sanitization and the health hygiene. And dentists should keep up to date with all latest advanced technologies and the instruction for the healthcare authority, experts, and the government. And the most important thing I could realize that when COVID pandemic is shifted to endemic, a large number of the patients will rush to the clinic, as many of the dental clinics were closed and patients could not come to the hospital and the clinic. So there will be very rush of the patients to your clinic. So be prepared. The dentist should be prepared to provide adequate manpower for the following few months with the logistics, and as well as increase their resources and utilization of the resources. That's my advice or my recommendation for all. Thank you so much. Thank you for giving me the floor, and have patience hearing.
Thank you very much, Dr. Anwar. Just comment that one of the listeners wants to know that what about respirators? There is some controversy regarding the airflow going out from the respirator. Should we prefer the industrial respirators, or an N95 is the gold standard?
From my opinion, if you want my opinions only, and I would like to use the N95 mask and that equivalent. And for extra protection, you can use 1 or 2 surgical masks over it, and it is enough for any dental procedures. Rather doing clumsy things for respirator, and there are, so you have already told that there are so many controversies, and so better protect yourself from the N95 and equivalent with the facial shield. That is very important.
And the second question is that is this IQ air system, which is very popular in some parts of Singapore and the Southeast Asia, is it is it better than air ventilation, or is it equivalent, or the ventilation is the most important?
The ventilation is important. It is very simple, and anybody can avail it in their chamber. But the IQ air system HEPA filters, this is high technology and expensive, and you can try it. Definitely, if you are able to do it, you can install in your chamber and it will give extra protection to you. But there are so many filters and air filters in the market, but be sure that it is especially for the scientific and hospitals and dental care. And IQ system is best, as I know.
Thank you very much, Dr. Anwar. We'll connect with you as we move forward. Thank you very much.